Simple. What if there's problems with breastfeeding? Today I have with me Caitlin Hainley. Caitlin is a certified nurse midwife and an international board certified lactation consultant. Caitlin, can you tell us a little bit about some of the common problems that new moms have in breastfeeding their babies and what they can do about it?
Some other things that we might find along our breastfeeding journey are pain can be a little bit common in the first few days. Sometimes there can be a little bit of pain, a little bit of pinching in nursing as we get used to that. But some pain is not normal. Pain that lasts an entire nursing session is not normal. Cracked or bleeding nipples are not normal. And pain, sometimes initially with Latch, we count to 10 seconds and it goes away. Then that usually eventually goes away altogether on its own. But if you're having those other types of pain, then you need to see a provider and work on baby's positioning, latch, and get a really thorough oral anatomy check, which will check for upper lip ties, tongue ties, anterior tongue ties, as well as posterior tongue ties. It also checks the roof of baby's mouth, their palate, and it checks how they move their tongue, that peristaltic motion. So a really good oral anatomy assessment with a trained provider can help us find out what's causing that pain and then how to navigate that, because we want this to be an enjoyable experience. And pain can sometimes inhibit milk flow. It causes that fight or flight response. And instead of our body relaxing and releasing oxytocin, which helps us release milk, instead we're tensed up and our body is not wanting to release that milk. So definitely we want to assess that. Other things that we want to be aware of are things like plug ducts or mastitis, engorgement. So engorgement is when our breasts get really full and really hard, and they're full of milk, which is great, but they're so full that it's really hard to get baby on. Most of the time, engorgement can be avoided altogether by making sure that we're nursing our baby frequently and often. Our babies need to eat 8 to 12 times in a 24-hour period, and they need to be latched on and nursing as long as they want until they come off in a contented state. There's no time limit to nursing in those early days and first few weeks. Babies really will just pull off, turn their head to the side, use your breast as a pillow, and go into a milk coma. And that's how you know they're done. And then you can put them on the other side. So if we're feeding our babies frequently and letting them stay on as long as they're indicating they need to, a lot of times engorgement can be avoided. But if you do get engorgement, that is definitely a reason to come in and see a provider or a lactation consultant, because they can help you manage that. They can help get that down, oftentimes with the use of cold packs and ibuprofen to really help with that swelling and inflammation. A plug duct is something you might have heard of. It's when milk kind of stops flowing in a certain area of the breast. You might see a red spot on your breast, you might feel hardness, and it might be a little bit sore. And what we encourage moms to do when that happens is to just massage that area very lightly and use some heat to get that area flowing again. You can even position baby so that their nose or chin is facing that plug duct, and that can help with drainage. Sometimes a plug duct isn't resolved in time, and that redness and that inflammation can spread, and it can cause an infection, and that's what's called mastitis. Mastitis can get very serious very fast. Oftentimes moms just feel really bad, like any sort of touch on their body is painful. They develop a fever. So if you are developing a fever or having severe pain on your breast or feeling flu-like symptoms, you'll want to call your provider right away because it's likely that you might need a course of antibiotics in order to clear things up and feel better. Thrush is another thing that can happen. It's simply yeast that's on the nipples and on baby's mouth, and moms and babies can pass it back and forth. It oftentimes causes pain throughout the nursing session. It can cause the nipples to be bright pink or bright red. It can make nursing painful. It can make baby irritable because their mouth can be sore as well. And that's another reason to see a provider, because mom and baby probably both need treatment, antifungal treatment, to get rid of that yeast infection and get everybody on the same page again.
So Caitlin, you talked about the ways that moms can tell if they're producing enough milk for their babies, but what if they're not? What are some things that a mom can do to help increase her milk production?
Yeah, so there are some things that moms can do to help increase that milk production. One of the most important things that we want to make sure is happening is stimulation. So every time that nipple is stimulated with baby sucking or with the use of a pump, it's triggering hormones to tell the body to make more milk. So one of the things that we often do is just advise moms to get more stimulation, and that can look a lot of different ways. That can look like just leaving your baby on longer until baby decides to come off, instead of timing your feeds and only giving baby 10 minutes per side or 15 minutes per side. It can look like just offering one more feeding per day, or sometimes it can look like pumping after some daytime feedings. Another thing that we really want to review when we're talking about milk supply is sleep and the role that plays. So prolactin is the hormone that makes milk, and that hormone rises in our bodies as we sleep. So making sure that we're going to bed at a decent hour, and that we're having some nighttime help with baby so that we are able to get as much sleep as possible, so that prolactin can rise and help increase our milk supply. Another thing is that sometimes new moms are really busy and they can actually forget to eat or take care of their own needs or drink water. We need calories to make milk. We need more calories as breastfeeding moms than we did when we were pregnant. So really making sure that you're getting those calories that you need, you're making sure to get good protein, good healthy fats, and making sure that your water intake is really good. Now, if you're doing all of those things and you're still having trouble, this may be a reason to talk to your healthcare provider. There could be a deeper issue going on. There could be a need for supplements. There could be a need for medication, or there could be a physical problem that we were never aware of. So talking to our healthcare provider can really help us navigate all of those things. One thing I do want to talk about, though, is galactagogues. Galactagogues are things that we ingest that increase our milk supply. Now, every culture has galactagogues. My first baby was born in China, and there they use pig's foot soup to increase milk supply. So I ate a lot of pig's foot soup. In America, one of the things that we often hear about is lactation cookies. So again, every culture has their galactagogues, and oftentimes we don't have a lot of proven studies, but it can also just come down to calories and fluid intake again. Lactation cookies have a lot of calories in them. Pig's foot soup has a lot of calories and liquid. So again, if you're having questions and you're really feeling like you're getting to that need where you want to try a different galactagogue, or you want to try to ingest a different food or a drink or a supplement to help increase your milk supply, I really encourage you to see someone who is well versed in lactation to make sure that we're getting to the root cause of the problem and approaching it appropriately.
So let's talk for a minute about some things that dads can do to support new moms in their breastfeeding efforts.
Yeah, that's a great question, because sometimes it can be hard for dads because there's so much that babies rely specifically on mom for. But part of dad's role in those early days is supporting mom. So helping hold baby, helping do some nighttime changes so that mom can get some good sleep, making sure that mom has water, good snacks, all of those things dads can do to help support mom. Now, there's also things that dads can do to bond with baby, right? Bonding with baby is not just about breastfeeding. So dads can hold baby, dads can do bath time with baby, dads can read to baby, because early reading, even to newborn infants, is shown to be beneficial. So there's lots of ways that dads can be involved with baby and also helping mom at the same time.
We talked a little earlier about the importance of early skin-to-skin contact between babies and moms. Well, there's evidence for that importance of skin-to-skin contact between babies and dads too. Obviously, the dads can't nurse the babies, but you can hold the baby with skin-to-skin contact. It's a great bonding experience. It's good for the babies and it's good for dads. Dads can have a wonderful role in assisting mom with just simple things like getting the baby for mom. When my first son was born, it would be my job to get the baby up when the baby was crying, bring the baby to mom and let her nurse the baby, and then I'd have a little time with the baby right after to bring the baby back to bed.
Dads are also really great swaddlers. My husband was 100 times better at swaddling than I was. He always swaddled the baby and did very silly walks down the hallway to get the baby to quiet down and rest a little bit more.
Well, those great baby calming tips are something that dads can do. I'm going to have a separate video on that coming up soon too. So I've been a pediatrician for over 20 years, and I've helped babies and I've helped moms with the process of feeding and breastfeeding. But I knew that in bringing this topic to you, pediatricians like me vary a whole lot in terms of how much we know. I know a bit. I've taken some coursework. I've read a book. But there's no substitute for the help and advice of someone who is professionally trained to assist with breastfeeding. So if you're having any difficulties at all with breastfeeding, or you simply want tips and advice, one great thing that I think we would both echo recommendation is to find a professional who can really help you out with that. The other thing is, if you're breastfeeding your baby and you're thinking about quitting breastfeeding or supplementing, please be sure to talk to your baby's healthcare provider before you make a change. That healthcare provider can give you some good advice that can maybe help you prevent from needing to make a change, or help you advise you to do the best thing for your baby when you do make any changes. Caitlin, this is, in the 20 years or so that I've been seeing babies and answering questions from moms, I've learned more in the last 10 minutes of listening to you talk, I think, than over that 20 years. So thank you so much for helping me with this video today. Parents, remember that breastfeeding is one of the best things that you can do as a parent, and one of the best things that you can do for your baby. It's not always easy, but there are things you can do if you're having problems. New moms, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.